Good evening, everyone, and welcome to this session of Plant Forward. Plant Forward is organized by ACT Asia's Compassionate Choices Network, the CCN. We are a community of organizations across Asia working to promote plant-based diet and sustainable lifestyle across the region. Plant Forward is our annual event, and we're very pleased to be able to welcome you, that you've joined us tonight. Tonight, we're going to be talking with Dr. Lakshmi Sundar from India. She is actually a consultant doctor from Sharon, who is a member of the Compassionate Choices Network from India. And tonight, she's going to be talking to us about the health benefits of plant-based diet, in particular with regards to how it can help us treat, manage, and even prevent diabetes. So thank you, Dr. Lakshmi, for joining us tonight. And we also have with us Joylyn. Joylyn is with Sharon, and I'm going to hand it over to Joylyn and Dr. Lakshmi, and Joylyn will introduce and tell you a bit more about what Sharon does in India, and then we will dive straight into the interview. Thank you so much both, and really looking forward to this interview tonight.
Thank you, Joy. Hi, everyone. I'm Joylyn, and I'm from the Sharan India team. A little bit about what Sharan stands for. It stands for Sanctuary for Health and Reconnection to Animals and Nature. We are an organization that's dedicated to spreading awareness about holistic health. And Sharan was founded by Dr. Nandita Shah in the year 2005, and since then, we've had an ever-growing team of doctors, nutritionists, health coaches, and facilitators and volunteers. And we're all brought together by a common vision of building a culture of health. Thank you, Joy. Shall I start with the questions, or would you like to introduce?
Well, it would be great if you can introduce Dr. Lakshmi as well, because I know that she's been with Sharon for quite a few years now, and her specialization and background, that would be great.
Okay, so Dr. Lakshmi has, she is a lifestyle medicine specialist, but she's worked with the Sharan team as a consultant for a while now, and she is specialized. I think she's worked with a lot of people in preventing amputations in diabetic patients. And a very interesting thing about her is that she is a long distance runner, a total fitness enthusiast, and she is one of the 3 certified Oxygen Advantage coaches in India. So yeah, so fitness is very much a part of what she does and what she preaches.
Great, thank you so much.
Okay, so I'll get started with the questions. So over a period of time, we've gathered these questions from from the people that we've interacted with on social media, etc. And so that's how we've come up with these questions, and we're hoping that this really helps people get started on their journey towards health. So I know I've already introduced Doctor, but Doctor, can you give us a bit more information about your current medical practice and a little bit of how you joined Sharan?
Sure. Thank you, Joylyn, and thank you, Joy. So here, I'm an allopathic doctor, a regular medical practitioner, and I worked in I run a diabetic foot amputation prevention clinic in Chennai, which is in the southern part of India. And well, what kept me thinking, we all became doctors because we wanted to heal people. But in the course of my journey as a doctor, we were seeing people getting sicker and sicker, and no one was getting better. Most were working in a diabetes hospital. I found them with worsening sugar levels, more people coming in with neuropathic pain and whatnot. And that set me thinking. And then I stumbled upon, like I had met Dr. Nandita Shah in Chennai and during one of her talks. And then I just enrolled for the course that they offer for consultants. And that was in 2020 during COVID time. And then I joined them on board as a consultant. And simultaneously, I also got my board certification in lifestyle medicine from the International Board of Lifestyle Medicine. And well, I've been practicing lifestyle medicine ever since. Because personally, also, I have benefited a lot from going whole food plant based and, from just being a vegan to whole food plant based to taking up sporting activities and other things. I healed myself too in the journey. And that's what got me to firmly join Sharon. My idea was to learn a lot, and I've been learning every day. The kind of patient that we see and the kind of work that we do, it's been a huge learning more than what I did in medical school, I would say.
Thank you, doctor. I feel the same because, being a part of Sharan, I too have got to learn a lot of things, and a lot of things about the whole food plant-based diet have surprised me as well. So moving on to the next question, according to the Diabetes Council in the USA, I know you're from India, but we have a global audience here. As of 2021, around 537 million people worldwide are affected by diabetes, and this number is unfortunately rapidly increasing. Can you explain to us what exactly is diabetes? What are the causes? And why has this become so common?
That 537 million people with diabetes, there is an equal number of people with impaired glucose tolerance. They're sitting on the wall, ready to jump into the diabetes bandwagon. And we come from a country which is the diabetes capital of the world. And so diabetes is just a chronic disorder where, in simple terms, the body doesn't know the body is unable to use food as energy. Okay, that's a very simple way of putting it. We know there are different kinds of diabetes. Type 1 diabetes is an autoimmune phenomenon where the body produces antibodies to destroy its own pancreas, and there is not sufficient insulin produced. People have to go on insulin because they don't produce insulin. But the more commonly seen type 2 diabetes, which is the inability to use insulin. Insulin is not effective. There is a lot of excess of circulating insulin in the body. It's a disease of abundance with excess of fat, excess of food, excess of insulin. And there, what happens is the body is unable to use insulin effectively because insulin's primary role is to push glucose into the bloodstream and to carry glucose to the muscle cells so that the muscle cells use glucose for energy. Now, what happens in diabetes, type 2 diabetes, which is considered a lifestyle disorder, there is fat sitting in abnormal places. So there's excess of fat sitting on the liver, there's fat sitting on the muscle cells. So when we eat, food is taken in, insulin is secreted, insulin carries the glucose to the muscle cells for conversion to energy. Because of the fat sitting on the muscle cells, the insulin is not able to push glucose into the cell. The receptors are blocked. So there's abundance of circulating sugar, there's abundance of circulating insulin. So excess sugar is a symptom of diabetes and not the cause for diabetes. The cause for diabetes is excess fat. And because it happens because of poor lifestyle choices, poor food habits, it is easily reversible, preventable, and reversible with lifestyle changes.
All right, thank you. Yeah, I know this is a very common myth that people with diabetes are told to avoid fruit and don't eat mangoes and those kind of misconceptions. And thank you for clearing that. Okay, so moving on to the next question. In your practice, what kind of cases do you see more commonly? Can you explain it in terms of the numbers of the glucose levels or the HbA1c levels? And how are you helping your patients control their diabetes or reverse the diabetes through a plant-based diet?
So I do see a whole spectrum of diabetes there. I've had people with type 1 diabetes also, where their sugar levels have, the insulin requirement has come down. Okay, when we talk about diabetes, it's just not bringing down the sugar levels. It's also talking about complications, because we know diabetes affects the heart, it affects the eye, it affects the kidney, the feet. It's a metabolic disorder basically, and can affect multiple organs. So we see people with type 1 diabetes where insulin requirements come down, and there are enough evidence to say that the organ complications come down when you could put them on a whole food plant-based diet. Okay. Well, in my practice, I do see people with all spectrum of diabetes. I had patients with a 300 plus sugar levels, with a HbA1c of 13 plus, and who've been on insulin. In 3 months, we've stopped insulin. The sugars have come down drastically from 13, it's come down to less than 7. And in the course of time, I've taken them off medicines too. And all this happens in 6 to 8 months. And what we're doing at Sharan is we're making lifestyle changes sustainable. So we are not giving them a dietary prescription. Instead, we're giving them sustainable food habits, sustainable lifestyle changes. It's just not food. It talks about exercise. We talk about sleep. We talk about stress. It's a multifaceted approach, right? So I've seen all ranges, and I've seen people with eye problems where they've gone back for a review, and the ophthalmologist has said, I don't need to give you any injection or anything for your eye, because your eye seems to have improved in 3 months. And I've seen people with neuropathic pain where the pain has gone off, burning pain in the feet. It's completely disappeared when they go on a whole food plant-based diet. So all spectrums, right? From a pre-diabetic to a full-blown diabetic on insulin. So we see the entire range there. And everyone is benefited. Whether we're able to take them off medicines or not, if we're able to bring down medicine level. And I'm sure when they sustain on this diet over the time, medicine requirement will completely come down. And a small minority of cases may require a small dose of medicines for a long time.
Okay, all right. I myself am actually a patient of Dr. Lakshmi, and she knows how much I sometimes struggle to stay on track with the lifestyle change. So this is a question for everyone. I know it's just not me. When your patients transition to this plant-based diet as a part of the treatment, what are the most common struggles and challenges that you face? I know you advise me, but in general, everybody needs to hear this advice.
To be very honest, I find dealing with vegetarians a lot more difficult than dealing with meat eaters. Meat eaters, they give up meat. I tell them initially, just do it like an adventure, stop. When they stop their meat and they see improvement in their energy levels and the sugar levels dropping, they are stuck to it. They are ready to add more vegetables to their plate and all that. With vegetarians, we have a lot of questions like, where do I get my protein from? Where do I get my calcium from? Why should I stop milk? And then you kind of have to tell them, look at the animal kingdom, mammals. Aren't we the only mammals who consume milk as adults? That too from some other animal. No other mammal consumes milk, after a certain period of time, right? And you got to tell them that it's not logical also. Okay. There are a lot of health benefits. And this is also, very important. Look at the animal kingdom. And what I find is they struggle with adding more vegetables to it. I see them struggling there. Many do not know how to, bring in the diversity in their plate. I find them struggling to cook, because we do whole food plant-based thing without oil. How do I cook? So there it gets very important that as a practitioner, as a physician, I also know how to cook. So when I share ideas with my patients, they trust me so much more. So, it becomes easier for them to adapt. When I give them tips, when I tell them about my struggles, when I transitioned, when I became a vegan, we didn't have any options available, right? Everything was a struggle. We got to learn how to make everything myself. So we kind of give them choices. They do understand. But what is very important is how are we going to make this sustainable? So I keep telling my patients over and over again, this is not a diet I'm giving you. This is a lifestyle change. Please do remember, this is a lifestyle change. Make your plate very interesting. If you're just going to slice some cucumbers and carrots and eat that every day, you will not be able to sustain it. So learn how to make food interesting. So I share a lot of recipes with them, a lot of ideas. Sometimes I share my meal plate with them, and they share their meal plate with me every day. So there are corrections. I tell them, how to address it. So that's very important. Yeah, they struggle with adding a lot of legumes and vegetables. This is what I see.
Okay, thank you, doctor. I know this is a bit off topic. I know we are talking about diabetes with Dr. Lakshmi. Apart from having designed a program called Defeat Diabetes for Sharan, where she, along with a chef, they handhold people on how to make that choice for themselves and the family. She also recently had a very successful program called Boosting Your Mental Health. Which was meant to help people prevent diseases like Alzheimer's, or at least maybe delay the onset. Maybe you would like to talk a bit more about these programs while we have people.
So the challenge that I faced during the course of my work was getting people to learn how to make their food, how to plan their day, because many people work and they find chopping vegetables or soaking legumes a very cumbersome process. So we put together a program along with the chef where, the chef would demonstrate recipes to them every week, and we would sit on a one-on-one consultation where she would tell them how to manage the kitchen and everything. Where I would talk about managing diabetes, she would talk about managing the kitchen, how to plan your meal, how to shop, this thing. It was very successful because people learned a skill along with disease management. Similarly, boost your brain health was, there were many women, especially, women are more prone to cognitive decline than men because the estrogen loss that happens after menopause. So, and a good lifestyle can prevent that. Eating a lot of the rainbow, basically a lot of vegetables, adding a lot of seeds, avoiding animal products, avoiding dairy, and movement, and keeping your brain active. Some ways to prevent or delay the onset of Alzheimer's. So we had a program for that. In the same manner, we had a chef. It was a doctor and a chef coming together and doing a program.
All right, thank you. And I'm just gonna pitch in over here that if you guys want to know more about these workshops, you can stay tuned on our website where we announce these events. So that is sharan-india.org. You can subscribe to our newsletter, so you'll get updates on all the varied events that we have. That you'll get to learn about Indian food and how to cook it in a whole food, plant-based way, without oil and without refined ingredients. Dr. Lakshmi has brought along a patient of hers who has benefited largely from her from a consultations with her, as well as following the Sharan lifestyle. So Dr. Lakshmi, would you like to introduce the patient?
So I have with me Mr. Deepak Malik, who is from Delhi. I specifically asked him to come because he's 63 years old. When people talk about remission or reversal of diabetes, they say it's only meant for people who have early onset diabetes. It can't work on people who have long-standing diabetes. This gentleman has long-standing diabetes. And when he came to me, I think I started seeing him in December, around the 28th December. I met him and his HbA1c was 10.8. And his main complaint was burning pain in his feet. He had a severe neuropathic pain. And his lipids were not so much out of range because he was already on, statins to lower his cholesterol. I stopped the statins right away because his cholesterol was just borderline. His LDL was slightly high and all that. And in 3 months, he was one of those patients who was very compliant, who was traveling, who learned how to travel and eat vegan food during travel, and who learned how to manage his day-to-day, eating. Staying on an Indian diet, didn't give him any fancy diet and all that, but then made him move a lot more. In 3 months, he brought down his HbA1c to 6.3. Right now it's at 6. And he's on a very low dose metformin, which I would stop soon too. And his sleep has improved. His burning has gone. He has no burning pain in his feet. And he will talk to you more about how he transitioned.
Hi, I am Deepak Malik. I'm aged 63. I'm diabetic from last 18 years. I was managing my diabetes with the diet control and exercise. However, in last year, September 2022, I started experiencing severe diabetic side effects like diabetic neuropathy, burning sensation in my foot soles, insomnia, weight loss. This is when I got my test done in December 2022, and I was surprised to see that my HbA1c level was 10.8, and my vitamin D and B12 levels were also very low. This is when I got in touch with Sharan, and they advised me to follow mainly the 4 basic fundamental points. Like first is follow plant-based diet. Second, no non-veg, not even eggs, no dairy products, and oil and ghee, and regular exercise. I'm supplemented by yoga if I can do it. Then I started following this plant-based diet. And while talking about plant-based diet, my favorite was smoothie with lots of greens and vegetables, which I took in the breakfast, and it became a regular breakfast for me. I started consuming a lot more fruits, vegetables, mainly raw and boiled, legumes, millets, and sprouts. Regular walks and exercises, mainly light yoga, part of my daily routine. After 3 months of following plant-based diet, my HbA1c level dropped from 10.8 to 6.5, and my vitamin D level and B12 also improved drastically. Consistency is the key for any diet regime to be followed regularly and religiously, along with regular physical activities. I got wonderful tips, few corrective advice from Dr. Lakshmi Sundar during regular follow-up with Sharan, various sessions. After 6 months of following above diet, my sugar level now has, HbA1c level has now come down to 6, which is a pre-diabetic range. And I'm very happy about it that I could achieve this. With wonderful blood sugar management side effects of diabetes, which I was experiencing in 2022, started disappearing, like my diabetic neuropathy and basically numbness in the extremities started improving. My burning sensation in foot soles nearly disappeared, and my sleep was also very good. No insomnia effect. Best part of plant-based diet is that it is perfectly sustainable, and as we observe, plant-based foods are aplenty in this nature, and planet has given us plenty of plant-based food to consume. My sincere advice to anyone who suffers from lifestyle diseases to follow plant-based diets, shun non-veg, shun oil and ghee, and along with the regular exercises and yoga, if you can do, you can win over any type of disease which you may be experiencing. Thank you.
Thank you so much, Mr. Deepak, for taking the time out of your busy schedule to come here and inspire all of us. And back to Dr. Lakshmi, I have a few more questions. Just want to talk about prevention. I know this would just apply to everyone, not just a diabetic. You know, how to maintain, how will this plant-based diet help you maintain your general health and prevent all lifestyle diseases like diabetes, to your PCOD, to your, you know, arthritis. I know there's just too much of prevalence of all this these days.
So what is a plant-based diet, basically? It is a low-fat, low-calorie, but a nutrient-dense diet. Okay? Whole food plant-based diet, that's what I'm talking about. So it is automatically, you don't have to count your calories. When you ask somebody to count their calories, it's very difficult. It's a poor calorie but nutrient-dense food. When you eat a lot of whole grains or whole vegetables, legumes, which are very important. And they are naturally anti-inflammatory. They are naturally antioxidant rich. They have all the colors that give us various nutrients. And they do prevent, because there is no inflammatory. What do they do? Basically, they keep your gut happy. We all know that gut is filled with a lot of bacteria. And the fiber-rich food that we consume as whole food, plant-based food, feed the gut microbes, keep them happy. They produce what is called short-chain fatty acids, which is very important to improve your insulin sensitivity, to lower your insulin resistance. And they work on just not the metabolism, they also work on the brain health. If your mood is largely dependent on how your gut is. So it's been proven that this kind of food has benefits for every single part of your body. Now, why no animal food? Again, we know that including dairy, all animal food has cholesterol because plants do not make cholesterol. They're high on saturated fat. Animal food is considered to be protein rich, but what we will forget is it's not protein rich, it's fat rich, right? So this excess of saturated fat is going to cause insulin resistance. And many more of your metabolic disorders, the starting point is insulin resistance. So excess deposition of fat, cardiovascular mortality goes up, diabetes, hypertension, name it. And even your Alzheimer's and dementia, cognitive decline, has a basis on that food. And not just the saturated fat in the diet, they also have excess of certain amino acids, which get converted, like choline and eggs and meat, can get converted into TMAOs, which can cause insulin resistance, highly inflammatory. Again, animal products have heme iron, which is easily available, bioavailable. But then, because it's easily absorbable, easily bioavailable, it is also highly inflammatory, right? And certain fatty acids, like palmitic acid, which is present in milk and meat, worsen insulin resistance. And milk protein, we all know, is common, is the single largest reason for type 1 diabetes and autoimmune disorders. Can trigger autoimmune disorders. So instead of relying on these animal-based products for nutrition, plants give you better nutrition. Plant protein, we know of so many endurance athletes who are plant-based. You know, long distance runners, people who run ultras, many of the sports personalities are going towards plant-based because they are anti-inflammatory in nature. And finally, they are good to the environment. And why not lead a compassionate way of living, good to the environment also, and follow a diet which is good to our body. So it's got multiple benefits. So this is going whole food plant-based, just not with one aspect is diet, but then moving, waking up early, exposing ourselves to the sun, going to bed at the right time, and relaxation techniques to reduce the stress that is normally very high in the present lifestyle. All these will go towards preventing any of the lifestyle disorders.
All right, thank you. You mentioned type 1 diabetes. how can a plant-based lifestyle help manage type 1 better?
Yeah. The type 1 diabetes, if you see, as I said, it's an autoimmune disorder and people need insulin because pancreas is not producing insulin. But even in those cases, we've seen going on a whole food plant-based diet with a lot of exercise does bring down the requirement of insulin. Okay. And as I said, this, high sugar load in the body can, along with the protein, can cause what is called advanced glycation end products, which can cause typically your kidney disease and the joint pain, stiffness, the neuropathic pain, and everything. Those kind of problems are definitely kept at bay because of clean eating, because of whole food, because it doesn't have any of the toxins that come in an animal food. It doesn't have excess of amino acids that come from animal food. It doesn't have the excess of saturated fat that comes from animal food. Whereas you're eating a very clean, naturally anti-inflammatory. And you don't have to count calories. People are worried about the high carb in a plant food. They don't have to because it's whole carb, which means there's a lot of fiber attached to it. The absorption is not going to be instantaneous. The same with fruits. People are scared of fruits, and all my patients eat mangoes and jackfruit, which are typically avoided by the typical medical doctor would say, stop, typical doctor. I don't. I let them eat it, and they all enjoy it. Sugars don't go up because that's the only form of sugar that they are consuming. What I would be scared of is the refined flour or the added sugars that we find in so many packaged foods.
All right. I think that is pretty much it for all the questions that we have compiled over a period of time. Thank you so much, Dr. Lakshmi. Thank you, Mr. Deepak, once again for your time and for sharing your story with us. And for all the audience here, I really, really hope that this inspires you to get on a plant-based journey and, take health into your hands.
Well, we do have lots of questions that have come in from the audience. And so since we do have a bit of time, Dr. Lakshmi, if you don't mind, I'm just going to ask up some of these questions. You've just mentioned fruit and sugar. And yes, again, this is, I think, something that we hear over and over again about not eating too much fruit because of the sugar content. Now, I'm sure a lot of our audience are going to be very happy to have heard you say that they are allowed to eat fruit. Rather than just openly, in general, that they can eat fruit. Is there any sort of specific things about how to do it? Would you pair fruit with other vegetables or other, grains? Is there something that you need to do to combine that together? Or if they're hungry in the afternoon, is it fine to just, grab an apple and eat fruit on its own? Is there something else that might be needed to regulate the sugar in the fruit as we eat that?
Not really. What I tell, we normally ask our patients to have green smoothies in the morning because greens are a powerhouse of nutrition, and they have a lot of fiber. Combining a fruit and a green is a good way to consume the fruit. That's one thing. I do ask my patients to have a fruit as a snack. I said, when you need a snack, grab a fruit. Or when you are craving a dessert, just grab a fruit. And because it's just not the sugar that is in the fruit, the fructose, but it comes packaged with the nutrients, phytonutrients, and the fiber. Every fruit is a fiber. So you don't have to be scared. So for people who do have some difficulty in sugars going up, the way they process the fruit, I tell them to add a little bit of a seed or a fat into it, like some sesame seeds or just a little bit of peanut butter or tahini and have it. The sugars automatically kind of stabilize.
I see.
And
Okay.
there's no restriction to fruit. Any fruit and every fruit. Yes.
Okay, that's great. So just to restate that, so sometimes if sugar is a little bit of a concern, you can include a bit of things like nuts that have a bit more oil, and that helps in terms of managing the sugar levels. But fruits are very good when we get cravings for sugar or when we want to snack. And then the best thing in the morning is to have lots of greens because that's the best way to kickstart your body. Yeah, that's really, really helpful. And the second question that we've got coming in is rice is such a staple in all across Asia, and we have a lot of people tuning in. And I think one of the things that we hear from the doctors a lot is you have to watch your carbs. You have to give up your rice. You can't eat rice anymore. I know that for Chinese people in particular, we do traditionally eat a lot of the refined white rice, and that is getting less and less popular, obviously, and it's being replaced with grains. But again, there's this question about rice and noodles being very much a core part of our Asian diet. And what would you recommend to,
I also
do we have to give it up?
You don't have to, because I come from a part of the country where we consume rice. Rice is a staple. I come from the southern part of India where rice is our staple. And no, you don't have to. Carbs, yes. What kind of carbs is the question? We would say no to refined carbs, not all carbs. Carbs as a source of energy for all of us. We need carbs. So a whole carb is what is the replacement. Now, rice can be had provided it's the unpolished rice, which carries the outer coat bran with the fiber and all the nutrients that come with it.
I
So,
see.
I think unpolished rice is getting really popular, the black rice, and you do get red rice varieties which are unpolished. And in India, we get far more indigenous varieties of rice, which are grown natively, which are now available without being polished. So we do recommend that. Again, noodles, don't use the refined wheat flour. Instead, you could use wheat noodles. Now you get buckwheat noodles or soba noodles, and you also get millet noodles. So you could use any of those variations rather than the refined. And how you eat the noodle is also going to change. Have them with a lot of vegetables.
I see.
Typically, the Westerners have a lot of spaghetti when Europeans. So we say when you have the spaghetti, have it with a lot of vegetables and the bean. So then the consumption of the grain comes down automatically.
I see. Great. That's very, very helpful. And I guess the same thing would go with for bread as well. Again, it's just what kind of flour we use. We want to make sure that it is unprocessed wheat. It's whole food, right?
Yeah, people living in blue zones where the longevity is the highest, people are very healthy. They eat sourdough bread regularly as a part of their daily diet. So I normally tell my patients, if you can find good sourdough bread, have it. It's fermented naturally, and the sugars are broken down further. So healthy and whole wheat breads, provided you know the source of the bread. I don't know how it is in the rest of the world. In India, whole wheat bread has to be taken with a lot of caution. We have to check the label to see. Definitely whole wheat. There isn't any other added ingredient.
Right. Okay, great. That's very helpful. Let's see. I do have a bit more questions coming in terms of another myth that I think or advice that we often receive is talking about how we order our food. So I know that I've read about it myself as well, where nutritionists or doctors have advised that when we sit down to a meal, there's an order to how you eat food to sort of kickstart your digestion properly, that you should start with vegetables and then move on to carbohydrates, and then sort of like leave the more sugary stuff to the end. Does that apply, or do you think that's helpful advice as well? It's quite difficult when I'm sitting down with a bowl of noodles, and I've got everything all piled in. I don't want to be picking out my vegetables first before I can eat my noodles. What's your advice on that, doctor?
Yeah. Now, we normally say start with your salad because it fills you up.
Okay.
Fills you up, so you don't go heavy on your grain, because we're basically grain eaters, right? So you don't go big. But if you're making a single pot meal, like one pot meal, I would say just tweak the ratio, add more vegetables.
Okay.
Add your noodle bowl, add a lot more vegetables than you would normally add, and reduce the quantity of the noodle. So you're still very satiated because you've had your noodle, you've had the flavors that go in with it, but you're still eating a lot more vegetables. So you could tweak your single pot, dishes that.
Okay, great. But generally, then the idea is to start with like the salad or the vegetable, hoping it's more about having that to fill you up so you don't fill yourself up with other things.
Yes.
Okay, that's great. And somebody else has asked, you've talked a lot about exercise and moving. We all know that exercise is very, very important, and in terms of treating diabetes as well. But with the modern lifestyle, things being so busy and we all working full-time jobs, I think it's been it's definitely, even for myself, it's quite a struggle. And in terms of balancing our food intake with the amount of exercise that we do you have any advice in terms of like what time of the day, or how many times per day, how many times per week? I think recently there's just been a few studies out saying you don't have to walk 10,000 steps a day now. You only have to walk 3,000 or 4,000 steps a day to stay healthy and all these things. So can you speak just a little bit more about how we combine diet and exercise and sort of like generally in our daily routine, how to manage that?
Yeah, sure. So the WHO says you need to exercise moderate intensity aerobic activity for at least 150 minutes per week. Okay, which means you got to walk at least 30 minutes 5 days a week, or swim 30 minutes 5 days a week, or cycle 30 minutes 5 days a week. Now that's easy to do, actually. A brisk walk where you can talk to your neighbor but you can't sing. That's what is the prescribed pace. Now, in a diabetic, strength training gets very important, where you move your body against resistance. The resistance could be your own body weight, it could be a band, it could be weights as such. And I do insist that women who are perimenopausal, postmenopausal, should definitely strengthen to prevent osteoporosis, which is very commonly seen in postmenopausal. Now, why strength training? Why building muscle mass? Now, we all know calorie in versus calorie out. The calorie deficit has to be maintained for anybody to lose weight, and more so in people who are diabetic, obese. We want them to lose that weight. So you generally, when they go on a WFPP, they're normally on a calorie deficit. Now, beyond a point, you can't keep coming down on the food that you eat, because as you lose weight, your calorie requirement keeps coming down. So you can't keep reducing the quantity you eat. Now, when you exercise, you're building muscle mass. Muscle is a high energy organ that will keep your basal metabolic rate for a very long period. Exercising, plus in strength training. That's one. Genetically also, when you exercise, your muscle reuptake of glucose is better. Which is a flaw in diabetes. The reuptake mechanism gets kind of corrected. Right? So building muscle mass. So strength training at least 2 to 3 days a week is very, very imperative. It's very important, not just for the overall health, it's very important for the brain health also. You want to keep your brain happy, please do a lot of exercise. And now it's easy. Lack of time is something that I always tell people. You can always find time. Any part of the day. You're convenient. Some people are morning person, some are evening persons. You can do any part of the day, but move. On adding on to it, I also ask all my diabetic patients to walk for 10 minutes after every meal. That does impact the way the glucose is utilized. It does.
Nice.
Any kind. I said, if you can't walk, just sit, keep moving your arms, keep moving your legs, use a band and move your legs against that resistance. Just move. So it's very important to keep moving through the day.
Thank you so much. That's so helpful. And because we've talked again, losing weight, and you had said that, fat is one of the problems or the cause of diabetes. Now, there's been questions coming in about people who actually are very skinny. They say they're diabetic, but they're very skinny. They're actually struggling to gain weight. They're losing weight. And one of the myths, I guess, of continuing to eat meat is that eating meat would allow them to maintain or gain weight. And they're actually quite afraid to go onto a vegan diet because they feel like if they do that, they're going to keep losing weight. Do you have any advice for people in that situation?
Thanks for the question, because I've seen we commonly Asians, we tend to be the skinny fat type. You got it? We're skinny, but we're fat. Where's the fat? Fat is sitting on all the organs. This is a very common problem with Asians. Okay, that is
Yes.
why the WHO has set the BMI at a lower range for the Asians. You know, for the rest of the world, if it's 25, for us it's only 23. Over
Mm.
that, we consider overweight. Okay, so the BMI is set at a low value because we are skinny fat people. So we can, what the fat that I'm talking about is not under the skin, but it's sitting on the organs, right?
I
Where you
see.
can't see it. And if you check their cholesterol, you'll see them all out of range. The triglycerides would be out of range, but they'd be very skinny. I do see many patients like that. And I tell them not to worry. I said, yes, when you go on a WFPP, you will tend to lose weight, but don't worry. There, your activity becomes very important. Building muscle mass becomes very important because that's the way you gain weight also.
I see.
So we do tell them, you will initially lose, but then after a point of time, you will stabilize because you're getting rid of all the junk that you've been eating and you're eating clean. You are bound to lose a few kilos, but then don't worry, you will put them back. And the moment you start working out and your muscles start toning up, you will see your scale going up a bit.
Okay. That's great. Thank you so much, Dr. Lakshmi. And I think we're getting close to the end of our time. So I just want to say thank you again for joining us today. And thank you, Joylyn, as well. Really appreciate it. And I think it inspires us to change our lifestyle, to eat clean, eat well. But I think also it has given a lot of hope to our audience that, you know, it's been great to hear you say that the sugar numbers, the glucose numbers can drop after 3 months. You know, it's not this, it's not going to become something that plagues us for the rest of our lives. And I think that is one of the brightest messages that we can give to people in terms of a sustainable change, a sustainable lifestyle change into plant-based whole food diet. And definitely diabetes can be managed and even prevented in that way. So thank you everyone for joining us tonight. It's been very, very inspiring and informative. We hope you will join us for the other sessions in our Plant Forward series this year and learn more, stay healthy, live sustainably. Thank you very much.
Thank you. Thank you. Thank you.